Woodstock is like a lot of places in Canada. It has great outdoor things to do, parks, rec fields, and people in Woodstock want their kids to grow up healthy.
We value our kids in a way that comes with a small town kind of ethic.
We wanted to protect the health of people, especially children.
If we're to move forward and prevent illness in our society, we need to pull together at a community level to do things that will create healthy living conditions so that people can easily become or remain non-smokers.
The city of Woodstock, what a wonderful place to live in. I've been here all my life and have watched it grow. It's very progressive, wonderful community, very active in all aspects. We have a lot of participation in the outdoors, and I think one of the biggest places that we noticed it at was our community complex, that as soon as you came out of our smoke-free facility, you walked into a cloud of smoke.
The story of how we arrived at an outdoor no smoking bylaw started with county public health.
Oxford Interagency Council on Smoking and Health has been active in promoting smoke-free areas for a number of years. We wrote a letter to the City of Woodstock asking them to consider expanding the bylaw and making any outdoor recreation areas, parks, and building entrances smoke-free.
We are surprised to get a reply very quickly from Council asking for further information.
We provided Council with a scientific report from Stanford University which discussed the harmful effects of a plume of cigarette smoke in an outdoor space.
Carol brought forth amazing information to us. It was easier to make a good decision because we were well informed.
Also, we considered the role modeling that people who smoke have on smaller children. We're trying to create an environment where smoking is not seen as a normal activity.
Having understood what the medical consequences are, hearing nothing from the public that was really objectionable, having the bylaw language clear and precise and the ability to enforce it, it went through unanimously.
Very few times we had the opportunity to issue a ticket where someone was a repeat offender or was just ignoring the bylaw altogether. So our focus was education. Our focus still is education.
We used existing networks. We have contacts at the schools through school nurses, through early years programs with our staff there. So it was fairly simple to get those fact sheets and pamphlets out through the organizations we work with.
It's been a good response. We have actually noticed a lot of people standing outside of the 15-meter radius of the benches, and when they're done, they go back and they sit on the bench with the rest of them. And it's a pretty good sight to see.
Once the bylaw was in place, we were looking for an evaluative component to help share what we had done here, and we had an excellent opportunity to work with the University of Waterloo.
The collaborations in this project were just terrific. There was a group from the Ontario Tobacco Research Unit working with people from the University of Waterloo, and it was really a pleasure for our centre that's funded by the Canadian Cancer Society to be able to come in and support this project in a small way.
They did a pre- and a post-bylaw survey so that the whole process was evaluated.
What we found in our rigorous evaluation of both general population and also the targeted sample of smokers who are actually smoking in those areas, what we found is that the Woodstock smoke-free law in outdoor places has worked tremendously well. Smoking in those key areas went down and support went up, especially among smokers.
What we found from this evaluation is that smokers like the bylaw. They support the bylaw.
So really, this is a tremendous sign to other communities throughout Canada, throughout North America and the world, that smoke-free laws in outdoor places can work.
Thinking back about the whole process of the bylaw, it just seems so easy.
Talk to your city council members. Certainly get in on the ground floor and work with them as closely as you can.
I think magic happens when public health departments work with politicians. That's when you really get steam built up and things actually happening in the community.
If it can work in Woodstock, it can work in many, many other communities.
Just go for it. Do it for the health of your community.
Take direction from your citizens, and you will find that you will be doing precisely the same thing that the City of Woodstock did.